I'm Alan Dale from Gale Force Winds, and what an absolute pleasure it is to be here in beautiful Nanaimo, British Columbia, talking to my good friends at Discovery Community College. I like talking to people that are making a difference. And on that note, why don't you introduce yourself? Tell us what you do.
My name is Stacey Castle. I'm an LPN. I graduated from Discovery Community College. Before that, I graduated my RCA through Discovery Community College. So I actually, full circle, have come back to the college as an instructor 5 years into my practice. So very, very full circle. I also work at several different island health sites up and down the island. Med Surg is primarily where I mostly work. I do work in Emerge as well periodically.
Wow. Talk to me about your journey to get into the healthcare field. Well, what were you doing before, and what brought you to this?
There was no before for me. I graduated high school and went right into my care aid program. Actually, it was my dad who really suggested it. I remember being super impacted when I was around 14 or 15 years old. My grandmother was very sick and she went into the hospital, and I saw the care that they provided her. And I remember we were walking out of there one day and I said something to the effect of my dad, of they love her just like we do. And he's like, I think you have those qualities too. So he really pushed me into the care aid thing. And then from there, I quite honestly fell in love with healthcare. I fell in love with the politics, the caring for people, the ethics is a big thing for me. And it just kind of snowballed from there. And then nursing was always a dream for me. And I kind of stood, I think I can say now, I stood my own way from that dream. And then I sat down, met with the college, and they really helped me realize that that's a dream that I could accomplish and could do. It was in reach now. So then I reached out and I grabbed it. And I think one of the things for me as a brand new grad was I want to experience all the different flavors of nursing, which kind of led me to this travel around the island, right?
Talk to me about your experience at Discovery. How was that?
It was wonderful the whole way through. Like when I did my care aid program, there's a reason I went back, right? They got me into my program way quicker than I ever could have hoped or expected or dreamed of. I was so lucky with great instructors. I quite honestly don't think I would be an instructor without. There's a couple people that I definitely can see their faces in my mind as I'm talking about this, that inspired me to share what they had given to me, essentially. So it's this very cool thing in healthcare where we pass down our experiences, right? And I'm in love with that idea of just carrying forward knowledge and getting a little bit better every day at what we do.
I love that. You talked earlier about trying all the different flavors. That's a great expression for sure. But it leads me to believe that the scope of practice for nurses right now is expanding, and there's just so many opportunities, and there's so much flexibility. Talk to me about how that must feel for you to know that it's basically the sky is the limit.
It's our market right now, really, to do whatever we want, really, and whatever we're called to. So when, like, as a care aide, I certainly felt a little bit more restriction on where I could work and what I could do. But even that, I was offered more opportunities than I expected, like home support, long-term care, more hospitalized care. And opening up the LPN door, I was really under the impression of, okay, this is going to open up some good doors for me. But I really didn't think that it was going to lead me to where it has. So, and we have done a lot of scope expansion, especially here on the island. So that looks like now our LPNs are doing IV insertions, right? We're learning how to do ECGs. And I think just that continued growth of learning it keeps us fresh. It keeps us on our toes. And it's so good for our system as a whole to be able to, like, I feel since scope expansion that I can better support the RNs on the floor, which oftentimes I'm having to put tasks on them. Right. So it's nice now that when I put one of those tasks on the RN that is out of my scope, there's other things that I can do to help kind of bring the team back together as a whole. Right.
What would you say are some of the sort of skills and traits a person should have when they want to be a nurse?
I think empathy, compassion, a big piece of treating people how you would want your loved one to be treated in the healthcare setting, right? I think the empathy and the importance of ethics. Sorry, my dog is just here in my face. But the importance of ethics and the importance of knowing who we are as people enough to be secure in that. Like, I know that sounds kind of, I'm trying to get to where I'm heading with this. It's very much just being human. I think that's the simplest way to put it. Right. So, and I know that's a really hard quality to kind of feed through applicants with. Right. So that's where we rely on our prerequisites as well. But I think just like I like to, especially with the students, like to get to know them as people. Right. And the group I'm working with now, I can safely say each of those people brings something very unique to healthcare. I think that's where I'm getting at is we need these different personalities, people from different backgrounds, different cultural backgrounds, different socioeconomic backgrounds to bring us to a place of we have a little bit of understanding of a little bit of all that we can, right? There certainly are things that we cannot, understand until we experience them, right? So
Thanks very much for bringing us into your conversation and telling us all about your wonderful profession. I'm glad that your dad at 14 saw something in you and you went down that path. You're clearly meant to do this. Thank you.
yeah, no, I really feel like I did have an injury as a carry aide, and I remember I was faced with, well, what else can I do? And the simple answer was there's nothing else I can do. This is what I'm meant to do. So I think a lot of us know that, especially like once we find our thing that's really set our soul on fire. For me, that's the patience, like that feeling of it feels so very purposeful. It's a very purposeful profession.
Thanks for your time.
Thank you.